Great, I think we're live now. So it's 4 o'clock and hi everybody. Thank you so much for coming to our webinar today, where we're going to show you our brand new functionality for batch messaging and appointment reminders. So yeah, thank you again for your time today. So our agenda is, let's start off with some introductions of who you're going to be hearing from today. And then we will run you through a reminder of what AcureX Plus is all about and any upcoming changes that you can expect between now and the end of March. And then we'll show you how the new batch messaging functionality works and the appointment reminders. And we've left some time at the end for questions and answers. So that is what we will be running through today. So first of all, in terms of introductions, so I'm Helly. I'm one of the partnerships leads here at AcureX. And Hannah, did you want to introduce yourself?
Yep, so my name is Hannah. I'm a product manager at AcureX, and I am leading on the batch and appointment reminders products.
So that is us. And then also we have our colleague Becky joining us, answering any questions on the chat function. So any questions, please pop them in there. Becky will give you an answer. And also we will, she will mark some of those questions that we can answer live at the end once we've gone through the demo. So yes, please do put your questions in there. Okay, so before we get to the actual functionality of the batch messaging and appointment reminders, I wanted to give everybody a reminder of what AcureX Plus is all about and what changes are coming from our side. So as I'm sure you'll be aware, accuracy usage has gone, it's surged really from 50% of practices a year ago to 98% of practices in England now. And with that, we have massively increased our team and what we put into our product development, so we can support the NHS going forward and keep innovating as we are. And with that comes growth in also our costs. So what we are doing now is having to move to a more sustainable business model. So we are transitioning to AcureX Plus, which is why we created this new paid tier. So that is the background to what we are doing at the moment. But first of all, just wanted to put everybody's minds at ease that there will always be a free version of AcureX for you in primary care to use. So anything that you see here in the top row will always be free. So what's going to be included in AcureX Plus? So some of the functionality that you are familiar with, namely the ability to attach documents to SMSs and to request a patient response, and also the message pathways. So those are the sequential messages. So that will become chargeable with AcureX Plus from 1st of April, and also the video functionality. However, with video, we are in conversation with NHS England, hoping that the central contract will be extended up until the at the end of the calendar year. So that is where it currently stands. We have also included in AcureX Plus some completely new functionality. So we've got patient triage on the left there. So that is our online consultation module. We have an extended suite of the Flories questionnaire. So these are the structured patient questionnaires. And then for the purposes of today, we'll be focusing on the batch messaging and appointment reminders functionality. So without further ado, I will hand it over to you, Hannah.
Great. Thank you so much, Helly. I will share my screen. Oh, I think you need to stop sharing so that I can start sharing. Okay. I'll share my screen. There we are. You should be able to see an EMIS in front. Just like a thumbs up, Helly. Make sure that's cool. So we have an EMIS up in front here. I had an AcureX toolbar. It seems to have fallen asleep. I'll bring that back up. Our batch messaging product integrates with both EMIS and System 1. So I'll be demoing today on EMIS, but it works the same way on System 1 in terms of what you would be able to do with importing information from the clinical system, and then also that information saving back to the medical record. So to start off with, I'm just going to create a list, get a simple list from population reporting. So I will just go into reporting, population reporting. You would be able to use any query that you would have in population reporting, such as doing a query on all of your asthmatics who haven't had a review within the last 12 months, or say any other QOF metric. You'd be able to also do it with other conditions or diseases, anything that you wanted to set up as a query, you'd be able to set up. I'm just going to create a simple list so that I have a patient to test with. So I will create a list of patients. I'll call this the Hannah test list. And I'm going to add myself as a dummy patient. I think I'm in this medical record just as a test patient, and we'll create that list. That just is going to take a moment to go through it in EMIS. But as I was saying, in both EMIS and System 1, however you're used to doing population reporting, you'd be able to use for the AccureX batch upload. So let's see if that's just still thinking through. As that's processing, we can go right into batch to see kind of the first steps of how it works. So to do that, you would click on your initials from the AccureX toolbar, and you'd click on this lovely little new batch messaging. That will open you up into the Manage Practice page. The Manage Practice page is a page that has different settings and additional web functionalities that are available in the web. And this would bring you up directly into batch messaging. You'd also be able to access it from the Manage Practice page, where you have all of your other different settings. And you see right here, you have batch messaging. So you'd open up that batch messaging and you'd click Create a New Batch. Here, we're already at that point where we need to go back to EMIS. So there are some instructions if you haven't done population reporting in EMIS, how to generate that report, or if you're using System 1, how you would do that in System 1. But lots of our users have lots of experience with this and are much better at it than us. So I now have this Hannah test list. I'm going to export that result as a CSV, and I'm going to include some population data so that I can save it to the desktop, and I'll call that included patients too. And then be able to upload it into batch. So I will now go to upload. I'll be able to grab that file I just saved. I think it was included patients too. It's now going to fetch the demographics from the medical record. So in EMIS, that's going to now check based on the NHS numbers of the patients that were in that. What are the phone numbers? As you'll see in a moment, we also have an ability to send Flories as batch. So it would need obviously the date of birth in order to verify the identity to send a Flory. So it was able to pull through that one patient that I had in that batch. Currently, you can send a batch up to 1,000 patients. We're constantly reviewing if we can increase that limit. Obviously, you saw that did take a couple seconds for that fetching demographics to work. Think if you have a list of a couple hundred, that can take a bit longer. So we just want to be cognizant of not creating too much wait time and slow things as we're uploading this. You then press continue and you get to the write message screen. So on the write message screen, you can just write a normal SMS. So you can write kind of whatever you want. Here is a test message. The patient's greeting will be pulled through in the same way that you get the patient greeting in one-off SMS with AccureX. The patient greetings for AccureX work so that if you are under 30, it would be hi first name, and if you are over 30, it would be dear salutation last name. I just turned 30 last week, so I will be getting dear salutation last name. So I would then click review message. I could select a SNOMED code if I wanted to. I don't think for this one I will, and it will send through. I think I already saw it pop up on my screen. There it is. So here is that test message that I got through from batch. This has actually not even uploaded. I got it even before it uploaded, so I can click here to refresh, and I will see that the status of that message will have gone from, yep, are sent, and now it's been delivered. You also see the status here of that it's been saved to record. So if I go back into EMIS, I open up that test patient, which happens to have my name. I open up that test patient. I would then be able to see that message that I just sent saved into the patient's record. Just one moment there. Yep, so there's that test message. As I was saying, you can also send Flories, so we can send another batch. We'll use that same CSV file just to show what it's like to send a Flory. It's pulling through the demographics in order to get both the phone number and date of birth. And I can now choose Flory, and I would be able to select any of the Flories that my practice usually has access to. So the basic Flories are the asthma, COVID, triaging, and flu vaccination invite. We also have a couple partnered questionnaires, and then we have our premium Flories, like Helly was talking about, in terms of the additional questionnaires that you would have access to. Flory is just basically AccureX's term for a way of collecting structured information for a patient. A lot of these are QoF related and help you reach your QoF targets, but are just really nice ways to be able to collect information from patients in order to evaluate which patients might need a little bit more time, either a telephone appointment or a face-to-face appointment when that's appropriate, appropriate, and which patients actually have really well-controlled asthma and don't need additional follow-up. So we'll choose the asthma questionnaire. I think I've actually already sent myself an asthma questionnaire, so that might not work. So I'll just choose the other one just for the example. I'm able to edit the text if I would like to. I would click review and I would click send. If a patient has already been sent that exact same Flories questionnaire, they wouldn't be able to be enrolled again. And this is to kind of protect the patient from getting inundated with the same questionnaire over and over again. Say if there's multiple very proactive staff at your practice wanting to send questionnaires to different cough conditions, that we would ensure that they're only getting one questionnaire and aren't inundated with messages. So click to refresh. I think that should have gone through to send. If I now very quickly fill out that questionnaire, it would be received via the Acure inbox. So if you're used to using Flories, it would work in the same way that it would work with other Flories. Let me just fill that out. Okay. And submit. And I potentially will see this tick up to 22. Yep, there it goes. So it would receive via the Acure inbox. You would open the Acure inbox, go to the appropriate Flories team. So this was an asthma questionnaire, and there I am as the patient, and I'm able to see the message that was sent to the patient in the batch, and then the response, which I can then click Save to Record with one click. All of these are tagged back into SNOMED codes, which will save into the record as SNOMED codes. So once that has uploaded, it's still saving there. All of those SNOMED codes would get saved into the record and help, again, count towards the QAF targets for your practice. While that is thinking, I will go through our appointment reminders design. So this we have here, it's not working. So the batch messaging product we have almost done. We have some final kind of tinkerings that we're adding to it to make it even better, but more or less is almost done. So here we can see those SNOMED codes have been added, and then the additional kind of free text questions that were part of the questionnaire. So batch messaging is almost ready to go out the door. We've tested with about 90 practices so far. So we've started to get some nice usage, and people are really enjoying using it. Our next step is to build out our appointment reminders flow. We haven't quite finished building that yet, but we do have a design that I can show you now, which is a picture diagram of basically what we would be offering. You can still see my screen. It says the Acure practice, right? Yeah, cool. So this would be from the Manage Practice page, in the same way where you would access the batch messaging system. You would be able to access something called appointment reminders. So you'd click on that appointment reminders, and you'd be able to set up a new appointment reminder. This works by pulling through whatever slots that you have in your appointment book in either EMIS or System 1. So you'd be able to choose multiple slots that you wanted to set up your appointment reminder to. Whatever you have these called in your appointment book, we'd be able to identify and pull through. So here's just an example of some that are called routine and urgent, but if they're called routine asthma check with Dr. L, that would be the slot type you'd be able to select. You then have the message text, where you have some merge fields. Merge fields are basically where information for that unique appointment or a unique patient would be pulled through. So specifically like date and time are good merge fields. In the future, there could be things like location, doctor's name, type of appointment that we could look at adding as well. But in the first instance, we will stick with date and time. You could also add additional information to that message, because it is a free text message that is relevant for either that type of appointment or that type of appointment reminder. In our first instance, we're going to just have it set up as a 24-hour before the appointment reminder. So if your appointment was on Tuesday, you would receive the reminder on the Monday before. That being said, in the future, we may look to create more customization around this, saying 3 days before, 1 week before, depending on what we see the needs are. But in the first instance, to just have that default 24 hours before. You would then just click reminder. It's sitting there working. You could go into edit or delete it if you wanted to. You could set up a new reminder if you wanted to. We would create some type of, this design doesn't show it, but to have kind of like a green dot that, yeah, this was last sent, or I guess that would be a red dot at this point. If it was last sent on the 9th, that means that it's not actively being able to scrape the appointment book and pull through the most recent reminders, and you would be able to know that you need to take a look at setting something up, because we know that sometimes that's a problem, that appointment reminder stop working in the background and you don't know. I have a simple design I can show you from the patient side, what the patient would see. So the patient would see a message about their appointment. So here we see these merge fields of the date and the time. This one also has location added. If the patient wishes to cancel the appointment, they would be able to click a link. This works very similar to how Flurry questionnaires work, the single responses work, where you would then be asked to confirm your date of birth, and you would then verify your identity as the patient before you're presented the information again, and you can choose to cancel your appointment. When you cancel the appointment, you get an SMS that says your appointment has been canceled, and that there would need to be some type of contacting the practice to rebook in whatever the usual way for rebooking is. In the future, we may look at having a rebook system, kind of like what AccuBook does for COVID vaccines, but in our first instance, we won't have that as part of the plan. I think that's everything I was supposed to go through, Helly. I'm happy to take questions or go through other things in more detail.
Yeah, no, that's fantastic. I see we've got a number of questions there in the Q&A section. So let me share my screen again. Right, so what I wanted to run through quickly is how you can start using it. So there's two ways for practice and PCNs. If your population is less than 90,000, there's a very simple online form that you can complete. And once you've done that, we can send you a contract. Or if you are a federation or a CCG or any organization that's got a population of more than 90,000, please just email us at partnerships@acurex.com and our team will get back to you. And in terms of the pricing, so this is the table for practices and PCNs. So we have bundled the SMS functionality because we understand that practices want to have one provider for all SMS functionality. So and these our features complement each other. So we've included the patient document attachments, patient responses, batch, and the Flurry questionnaires as one for practices and PCNs with this pricing. And then obviously if there is a higher level contract in place that covers practices, then that would be discounted from the practice bill. So there wouldn't be any double payment. So I just wanted to clarify that. And now if we move over to Q&A. So Becky, did you want to fire some questions across to us?
Yeah, absolutely. We've got lots of product questions. So a couple on how many patients you can include in a batch message. So somebody's saying that they thought this was 500. Has it gone up to 1,000? And I guess second question, Hannah, is kind of, will that increase in the future?
Yeah, really, really good question. So last week it was 500. As we're saying, we constantly work on improving our products and making them better based on feedback. So we have increased that now to 1,000. We are potentially looking to increase it further. Kind of the trade-offs that we're thinking of now is that when you're uploading that CSV, it does take a little bit of time. The longer the list is, the longer the time would be. So we're just trying to weigh up those trade-offs and what's a reasonable amount of time to wait. The second kind of issue that we're identifying is around how that saves to record. Currently, it takes about 2 seconds per patient to save a message to record. So if your list is 1,000, that's already a 30-minute wait between when the message is sent to when it's saved. Which isn't necessarily ideal and potentially could have implications on slowing down the clinical system. We're still doing more research on that. We know that practices would love to be able to message their entire list, which is maybe 10,000 patients. We would love to get to that point, but if that takes a long time to upload, in say like 30 minutes to an hour to upload, and then takes up to 5 hours to save, potentially that's not a really great product. So we would obviously look to try to mitigate those things first before we just increase the list size and make it kind of a slow experience, because we know nobody likes to wait for software.
Perfect, thank you. And can users put in their own SNOMED codes, or are they limited to what's in the drop-down list?
Really good question as well. So currently we don't have an ability to type in a free text SNOMED code, just in case there's typos or for whatever reason that would then mean that the message would fail to save. So it is from the select list of SNOMED codes. That being said, we always take on board any feedback around SNOMED codes that you would like added. We've added lots more SNOMED codes because of COVID, obviously. So if you ever have suggestions of SNOMED codes that you would like to see in that list, you can always send us just a message on support.acurex.com. There's a live chat, and someone will be able to get back to you about getting that added within the next few weeks.
Cool. And can you attach documents to batch messages?
So that is something that is currently on our roadmap. We should have that out in the next couple of weeks. As you saw in the demo I had, we didn't have the attachments yet, but we're looking to both bring in templates and attachments because we know that those are really useful and save a lot of time.
Nice. And then while you're here, a couple of questions on Flurry questionnaires. So the first question is, will patients be automatically prompted if they don't reply to a Flurry? And the second question is, after what time frame can you send the same Flurry questionnaire?
So Flories, currently all of our Flories are on a 7-day timeout. So if the patient hasn't completed the Flory in 7 days, you'd be able to send that same Flory again. They receive a reminder message after 3 days and after 6 days, with kind of increasing urgency in terms of how much time is left for them to complete that questionnaire. We do obviously see a big uptake in when they receive those reminders that patients then who haven't filled it yet do fill. But on average, I would say our Flory completion rate is between 60 to 70%. So we do have a quite high completion rate across the Flories. I think highest right now is the COVID triaging questionnaire, which has like 68%, just because obviously that is being used for triaging patients before they come to practices when that's relevant, and that patients have a really high respect and response rate on that Flory.
Cool, thank you. And then a couple of questions on appointment reminders. Is it possible to have more than one type of reminder for one slot type?
That's a really good question that I'm not 100% sure of. We're currently doing our technical kickoff on how to get appointment reminders off the ground. From my understanding, you probably in the first instance wouldn't be able to send 2 different types of reminders to the same slot type, just because our system would get confused, and we want to obviously be really cautious with confusing patients and inundating them with messages when there's not a clear message there. But as we develop more, we'll obviously be really transparent with what we can and can't do, and that will be available on support.acurx.com and via other channels of information around our products.
Cool, thank you. And the second question on appointment reminders, will they code back into consultations and take up space? And this person's made the point that EMIS appointment reminders are in the care history.
Mm-hmm. So what we're looking at in the first instance is that you would have like a CSV that you could download of the appointment reminders that have been sent, so that you would be able to check if a patient had received the reminder or not. The feedback that we've got from our early user testing is that there's a concern that it could clog up the medical record if there are too many reminders in there. Obviously, if we hear otherwise, or if there's lots of feedback one way or another, we will adjust. We can save to record. A lot of Acurx messages do save to record, but it would just be making those trade-offs of what's appropriate and what information is useful for that patient's record or not. From our understanding, the most useful use case is that you want to make sure if a patient DNAs that they did actually receive their appointment reminder, and that you'd be able to check that. So we do want to allow for a workflow there, but it might not be saving to record in the same way.
Thank you. Okay, I'm picking out some questions for Heli. Can a practice or PCN kind of purchase modules now, and then if the CCG purchased them later, does the contract move to the CCG and the CCG starts paying?
Yeah, so if there's a contract that is at higher level than a PCN or practice, then that would supersede. So yeah, that is the case. So if you want to have something now, you can start paying for it now. In terms of functionality that we've got available now, so the Flory questionnaires, the extended suite, is available now. And for the batch functionality and appointment reminders, we are working to the beginning of May. So that is the kind of the very latest that you'll be able to start using this functionality that you've seen today.
Cool, thank you. And a second one, are the costs of the text messages included in the price?
No, so they are charged separately. So if a CCG already has a gateway in place where the SMSs go through, then that would carry on as it is. And if not, then the SMS cost would be invoiced a month in arrears to the contracting organisation.
Question on how many SMS fragments are in each Flory. I know that the average number of fragments in SMS in general is I think around 1.7 or 2 fragments. I don't know if either of you know how many fragments on average are in a Flory, if that's more or less.
I believe it's 2 fragments per Flory, but then also consider that Flories have reminders. So it could be, I believe, up to like 6 fragments per Flory if the patient doesn't fill it until the last day. And there's also a confirmation message that the Flory has been completed. So I believe it's about 6 fragments.
Thanks, Hannah. And how many characters are allowed per SMS message?
So I believe we have a hard limit of, I think it's like 612. That's a limit not from us, but from like SMS providers. We do know that patients prefer shorter messages and will have a higher read rate of shorter messages, as we all do. We tend to scan. So keeping your message short and concise is typically more effective, and we try to encourage that. But you can write a message up to 612, which I believe is 4 fragments.
Cool. Thank you. Can practices purchase the SMS modules separately, or do they have to buy the whole bundle even though appointment reminders aren't available yet? Probably one for you, Helly.
Yeah, sure. So as I mentioned earlier, so we've bundled the sort of SMS functionality for PCNs and practices. So that includes the Flories, the batch messaging, appointment reminders, and the SMS Plus, which is the patient responses and document attachments and pathways. So that they can't be bought separately at practice and PCN level, but if we are talking at CCG or ICS or STP level, then please get in touch on the partnership's email address, and we're more than happy to discuss that.
Thanks, Helly. And another one for you. Is there any discount for patient populations over 90K?
Yeah, so there is. Yeah, so if you get in touch again on that email address, we're able to give you a quote for your population size.
Cool. And back to you, Hannah. If it is a batch I'm sending to 150 patients, will they be coded automatically, or will I need to click save to record for each?
So when you send the message, like the outgoing message, it would save to record by itself. You wouldn't need to code each sent message by itself. If you are sending Flories, however, you would be receiving those responses via the inbox, and you would need to click save to record for each of the responses. So not for the sent message, but for the response, yes.
Perfect, thank you. Okay, if a patient cancels their appointment, how are we informed of the cancellation, and does it cancel the actual appointment?
So we're still doing a bit of technical discovery work here. Ideal state is that we are able to cancel the appointment directly from the appointment book. If there are strong opinions on how you would like to be notified, we're doing lots of research right now with users and with patients on appointment reminders. So you can just email me. My name is hanne@acurx.com. And we'd love to be able to speak with you more about thoughts there.
Lovely, thank you. Okay, I'll just go, bear with me a second, go right back up to the top and see if anything's been kind of upvoted. Do we currently do anything with the friends and family test?
Yeah, I can take that one. That's obviously been suggested as a Flory many times before. The concern being is that the way Flories work in the Acurx world is that they're all attached to a unique patient, and from our understanding, it's not really as relevant to have this like unique patient identity based on the patient's responses to their friends and family, and that they don't really make sense to be saving into the record. What's most useful is to kind of get an overview summary of all of the responses to the friends and family. Unfortunately, we don't really have a way of running questionnaires in that point. In that way, in the future we might, but Acurx has decided to focus predominantly on condition and clinically relevant information gathering. So that's a little bit limited from what we can do with friends and family.
Well, thank you. And is it possible, Hannah, to send a COVID triage questionnaire as a batch for all face-to-face appointments on a particular day?
Yes, that is probably one of our biggest current use cases for the pilot practices that we have, those 90 practices. I'm seeing, several COVID triaging Flories being sent per day. From my understanding, you can just do a query on your in your population reporting, either in EMIS or System 1, to get the search result of all of the patients that have face-to-face appointments. You can then upload that to Batch, select the COVID triaging questionnaire, and send them back. And those responses come back into the inbox.
Cool, thank you. And Hannah, is it possible to create templates for batch messages?
Really good question. So we're currently working on getting that in. We know that templates in one-off SMS save a lot of time. So we're doing something similar for batch as well. It won't be necessarily the exact same templates, just because we know that some templates make sense as one-off and some templates make sense more as to a group of patients. But there will be a way in the coming weeks to be able to send a templated message in batch. And you'd be able to create your own templates as well.
Cool, thank you. I'm not sure if we know the answer to this, but any plan to extend functionality into an AccuBook type setup, so allowing patients to book themselves into slots like a flu clinic?
Yep, no, it's a great question, and it is something that we're definitely exploring. There will probably be an intersection at some point of where AccuBook in the post-COVID world, hopefully, can turn into a recall system where you would be able to book patients for different types of either QOF or annual review conditions directly in using something like AccuBook. And obviously, AccuBook is a type of batch messaging because you do upload a CSV and send a batch invite. So there definitely will be overlap that we are exploring for the future.
Cool, thanks, Hannah. Helly, question for you. Can we elaborate a bit on the pricing? So this person's CCG is currently going through procurement for online consultations, but this won't be finished until the summer. How would the pricing work in the meantime if a practice or PCN wanted the batch or SMS features in April or sooner?
So this is really down to kind of contracting level. So if a CCG wants to have a contract in place and then have a reimbursement scheme in place, for example, for a practice, then that's fine. But if we have individual contracts with practices for batch, then the pricing that I showed earlier would apply. But obviously, the higher the population, then the more cost effective it is. And also we do the modular approach. So if you bundle more than one module through Acure Plus, you get a higher discount, so to speak. So that would be
Lovely. Thank you. And somebody just wanting to kind of clarify when they've said, when will we lose the video and two-way messaging functionality?
So in terms of the two-way functionality, so after the end of March, that will be limited to 20 per practice per week. So that would be 20 document attachments and 20 patient responses per week per practice after the end of March. Video, as I mentioned, we are in discussions with NHSE about extending the central contract up until the end of the calendar year. So yeah, if there's any changes to that, we will let you know. But our understanding to date is that that will be extended to the end of the year.
Thank you. How do you send appointment reminders for telephone consultations? One for you, Hannah.
So for telephone consultations, you would do it in the same way. So however you're doing your population reporting query, you'd be able to do a query of your all your patients that had booked in for telephone consultations, be able to send them a batch message. I just realized you were actually asking about appointment reminders, so I'm going to reframe my question. I'm working on too many things at once. I'm getting a bit mixed up here. So for appointment reminders, you'd be able to set up slot types for, so if you have a slot type called routine phone appointment, you'd be able to set up a unique appointment reminder for that slot type, and you'd be able to then change the text of that for however you would want that reminder to be sent to those patients, probably a bit different than if it's a face-to-face appointment. So it would be up to you what you're calling your slots in your appointment book, and then we would be able to detect that, pull those through, and you could choose what type of message to be sent to each.
Nice, thank you. And also with the appointment reminders, can a user customize the outgoing message?
Yes, so there is kind of like a little bit of default text, like what I showed with there's the little triangle things that say date and time. So those are merge fields, and those are kind of default text that we believe every appointment reminder should probably talk about what date and time the appointment is at, but you would be able to customize the rest of the message if you wanted to add additional information. So say you were booking in routine asthma reviews, you might want to say, please bring your inhalers and your asthma control plan if you have one. And that's a really nice way to ensure that patients are made aware of what they need to prepare before their appointments.
Nice, thank you. And do batch Flories that are returned have to be saved to the record individually?
So they do have to be saved individually to the record. We are looking at how we can improve the inbox management side of Flories in general, because we know that obviously when you can send hundreds of them at once, the inbound is going to become a new workflow. Again, if you have thoughts on this, like we're really happy to do more research and learn more about what is the ideal scenario. We don't have all the answers. It's definitely up to understanding our users and what they need. So again, you can always email me at Hannah, that's HANNE, at accurex.com about that.
Nice, thanks, Hannah. And I know this has come up now and then over the years, but will there ever be an option to create your own templates and pathways?
Yeah, so at the moment, no. It's not currently on our roadmap. That being said, we are going to be looking at, probably in the medium term, ways that we can improve the compose screen, so that basic Accurex writing a message to a patient, and it could be that we add in ability to schedule, which is kind of that halfway point of between where is a template and where is a pathway. So a scheduled then normal template message in a way would allow you to select a template and then have it scheduled for the future. But that is not in the short-term roadmap. That is definitely in the medium to longer term.
Nice, thank you. And a question around SMS fragments and how much they cost, which I can answer. So there's two options. Either we can send an invoice to CCGs, and that's costs 1.75 pence per fragment. There is also an option to add Accurex as a sub-account to local gateways, and then you just get the rate that the CCG has got with BT. So the reason it's a little more expensive if we're doing the invoicing is because that's something that we kind of do monthly in arrears. But yeah, there's still that option to just add Accurex as a sub-account to local gateways, and I think BT charge a £600 annual fee for that as well. I think a question around whether we've been approached from federations in Northern Ireland. I don't know if you're able to answer that, Helly.
I would have to go and check that. Yeah, sorry, don't know off the top of my head.
No, that's okay. Probably shouldn't have asked you about specific areas. Can Accurex Plus run alongside other batch messaging systems? Not sure who's best to answer that. Hannah, perhaps?
So maybe not me, but I'll try. So I'm assuming like if you have another batch messaging option and you're either running both batch and appointment reminders, you could then procure other modules in Accurex Plus. I think Helly showed a nice table of you have options in the modules, especially if you're procuring on the CCG level. And then you would be able to use your existing batch supplier if that's your choice, and then use other modules of Accurex Plus. I think that's answering the question.
Yeah, I guess just to add to that would be like if there's something that you think is missing from our offering, please let us know, because we are very much user-led in our approach.
Thanks both. And just a request. So please, can we create an oral contraceptive template and pathways? We can certainly pass that back. And someone wanting clarification. So can practices purchase Accurex Plus?
Yes, they can. So if you just complete the online form, which I will put it in the comments in the YouTube posting that whether this webinar will go. So if you find it there, that's probably the best way to access that. And we can also put that on our Facebook page.
So somebody whose question I might have not asked in the right way, and they've posted a clarification which I still don't understand, so I'm hoping Hannah might understand perhaps. Somebody saying, I asked above but not very clearly, are we able to put in restricted telephone numbers into AccureX instead of having to exclude from the search?
I don't know if I am an expert on this. I can definitely take it away and talk to our team about it. From my understanding, though, all of AccureX's products work on SMS, which means that they need to be mobile numbers. It's less common to have restricted mobile numbers than landline numbers. I know that's probably not 100% true case, but from my understanding, if you have a CSV with phone numbers and you're able to upload that, we are able to send the batch, given that we our system is built dependent on what is provided in that upload. I can definitely follow up on that and find out more information, though, about restricted numbers. It hasn't come up lots yet, so I'm sorry about the inconclusive answer there, but that's as much as I know.
Thank you so much. And can we confirm the date that the discussion about the video extension, I think this person's asking when will, if the video contract is extended, when will it be extended until, Helly?
So it would be until the end of the calendar year, so until the end of December.
Perfect, thank you. Perfect, I think questions are certainly slowing, and I think a lot of the ones in there we've kind of already answered in some format already, so we're probably almost ready to kind of start tying up. Just having a little quick scan. Yeah, I think if, of course, if there's anything burning, definitely send to partnerships@accurex.com, but I think we're pretty much there with the questions.
Yeah, that's great. And as always, if you've got any questions, please get in touch with our team of partnerships@accurex.com or our support team on the live chat on our website. And we'll be posting a recording of this on our YouTube channel for anybody who wasn't able to make it today in real time. And yeah, thank you again for everything that you are doing in primary care for all of us. And yeah, keep in contact. Great. Thanks, everyone.